Zambia is a nation that has faced immense challenges in its health sector. Statistics from 2007 indicated that 45% of children were stunted due to poor nutrition. 14% of the population, or over 2 million people, were HIV positive. Under 5 mortality was 119 out of 1,000 live births, and malaria was responsible for 20% of maternal deaths. All of these figures share a common root that can largely be addressed without any complicated or expensive biomedical interventions. They are the result of changeable behaviors and cultural norms. Enter Communication Support for Health, or CSH. Funded by the United States Agency for International Development, the President's Emergency Plan for AIDS Relief, and the President's Malaria Initiative, CSH began in 2010 as a bilateral partnership project with the government of the Republic of Zambia and aimed to enhance local capacity to promote healthy behavior in communities across the nation. Supported by the wealth of knowledge, talent, and experience at Chemonics International, the Manoff Group, and ICF International, CSH is a 4.5-year, $43 million project built on a foundation of research, evidence, and creativity. By integrating our unique behavior-centered programming approach into curricula at Lusaka Apex University, the General Nursing Council of Zambia, and the Zambia Institute of Mass Communications Trust, as well as directly training hundreds of GRZ staff, developing national communication strategies, tools, and strengthening technical working groups in all provinces, CSH has ensured that milestones will continue to be met long after the project ends. CSH and its GRZ counterparts set out almost 5 years ago to create a healthier, happier Zambia, and the project has delivered. Let's take a closer look at how. It is one of the most serious health problems facing Zambia today, HIV and AIDS. But we know exactly what behaviors are necessary to prevent it. To influence these behaviors, CSH realized it needed to craft messages that were both emotionally and culturally relevant. These messages came to life in a multi-channel comprehensive prevention initiative called the Safe Love campaign. 69% of Zambians have been exposed to Safe Love through TV, and 75% through radio.
A big man doesn't mean a big family.
Plus, it has reached 500,000 people through dialogue in small groups called Safe Love Clubs. And thanks to private sector partnerships, over 3 million homes throughout the entire African continent viewed the award-winning television drama Love Games.
I want everything to be right with you, Tashay. Every relationship I've been in, I've practiced safe sex. I use condoms and frequently go for HIV tests. But most importantly, I believe in being faithful.
This is how it's supposed to be. Petronella, all 3 kilograms of her, was born just moments ago at this health clinic in Zambia. A well-trained staff ensures mother and child are safe and sound. But most women in Zambia give birth at home, where the risks are much greater. CSH set out to change this through its Mothers Alive campaign. The campaign empowers families to plan for care during pregnancy, deliver at a facility with trained professionals, and to access family planning services. Using an innovative suite of communication materials and engaging local and traditional leaders as change champions, the campaign seeks to ensure that no woman dies while giving life. The Mothers Alive program trained a total of 350 change champions in 15 districts. Every single one of these has conducted outreach. Almost 50% have built mothers' waiting shelters, and more than half have created emergency transport schemes in their areas. Plus, more than 2 million birth plans were distributed, and 70% of women in our districts have used them to prepare for care during pregnancy, birth, and beyond. All of this effort has contributed to a 35% reduction in maternal deaths within the target districts. Malaria and child stunting are widespread problems in Zambia and are also part of CSH's focus. To address such complex health problems, the participation and ownership of an entire community is necessary. CSH facilitated this process with 131 communities in 8 districts across Zambia in an initiative called Champion Communities. Using monthly household monitoring data to measure progress, one-on-one counseling, weekly mothers groups, and innovative communications products, each community set its own champion goals and wrote action plans to achieve them. Our champion communities have had tremendous results when compared to non-target communities. 10% more children under 5 now sleep with the protection of insecticide-treated bed nets, leading to 7% fewer cases of under 5 fevers. And 25% more children under 5 were tested for malaria when a fever was present. In partnership with the Government of the Republic of Zambia and other coordinating partners, CSH is proud to have contributed a measurable improvement to Zambia's health status. According to preliminary results from the 2013 Demographic and Health Survey, progress has been made. Stunting due to poor nutrition decreased by 5%, and under 5 mortality lowered from 119 to 75 per 1,000 live births, meaning for every 100 children born, 5 more were able to celebrate their 5th birthday. Today's Zambia is a healthier, stronger nation than it was just 5 years ago. Changing the course of the country's health sector is a challenge, but by using clear, consistent, and constant communication that resonates with the Zambian population, CSH has truly empowered Zambians to change their behaviors and their lives.
Are lives being saved? Answer, yes. Second, do we attribute this to the activities of this particular project? And again, the answer is yes. We have learned from experience that communication is the most important part of our care for our patients. And because we are better communicators, we are able to save lives. We have seen it work. The end is a happy birth, a happy childhood. That is what we want to achieve.
Communication support for health is funded by the United States Agency for International Development, the President's Emergency Plan for AIDS Relief, and the President's Malaria Initiative, and is implemented in partnership with the Government of the Republic of Zambia.